Welcome to Season 2 of Talk Lab to Me. Talk Lab to Me is an engaging discourse podcast hosted by COLA, a leading physician-directed accrediting organization that provides education and accreditation services to laboratories of all sizes. The podcast covers a wide range of topics, including the latest developments in laboratory science and medicine, as well as in-depth interviews with regulators and industry thought leaders about the importance of regulatory compliance. Welcome to Talk Lab to Me. This is Season 2. I'm so excited to be back. I'm here again with my co-host, COLA CEO, Nancy Stratton. Welcome back to Talk Lab to Me.
Thank you, Danny. I am so joyed to be here with you and our marvelous board members.
Today on Talk Lab to Me, we are joined by our board of directors who serve on our education committee here at COLA. So I will let them take their turns to introduce themselves to you. Dr. Kenta Bibi.
Good afternoon, everyone. I'm Dr. Emmanuel Kenta Bibi, currently working at Middlesex Hospital in Middletown, Connecticut, and a representative of the AAFP to the COLA board. I work in residency education as an educator for residents and within the context of the American Academy of Family Physicians. My role involves both direct teaching and contributing to the broader goals of the organization. This includes acting as a role model, preparing residents to be teachers themselves, and advancing the quality of family medicine education through leadership and policy advocacy with the AAFP.
Hi, I'm Lynn Jeffers. I'm a plastic surgeon by training. I'm also a CMO of 2 hospitals in a health system. I sit on the board of trustees for the American Medical Association and really excited to be on the board for COLA.
Hello, I'm Rick Eisenstadt. I'm a somewhat recently retired primary care internist and a career medical educator. I actually began my career as a hematologist and a blood bank director at Temple Hospital. I was very good at clinical decisions about blood transfusion and not at all good at identifying obscure antibodies and doing complex compatibility testing. But I had the smarts to hire a terrific technologist as my supervisor, and the collaboration between the clinical expertise and the technological expertise has guided my career ever since. I'm a representative of the American College of Physicians and have been involved in that organization for many decades, serving mainly in education. Glad to be here today.
So all of those who listen to Talk Lab to Me, I want to let you in on something about COLA. COLA has 3 member organizations, AMA, ACP, and AAFP. So they are all representing our 3 member organizations. So just to let you in on some of the background to how COLA is structured. So we're going to get into it. From each of your organization's perspective, which I'm talking about our member organizations from a COLA stance, how do clinical laboratories contribute to delivering high quality patient care?
The American Academy of Family Physicians brings a unique perspective to laboratory medicine by prioritizing point-of-care testing in a primary care setting, where the vast majority of patient care happens. This contrasts with the traditional emphasis on large, centralized labs. The AAFP's focus is on ensuring diagnostic accuracy, improving turnaround times, and supporting the family physician as the central interpreter of lab results within the context of a patient's overall health.
I think from the AMA perspective, we advocate for robust clinical laboratory services. It's an integral part of evidence-based medicine and the overall improvement of patient care. Our advocacy really stresses the importance of access to laboratory tests, regulatory standards, and fair reimbursement. We also really believe that clinical laboratories play a foundational role in delivery of that care. That could be accurate diagnosis, treatment guidance, monitoring disease and management, and preventive care, and also quality safety assurance. So all of the things that COLA has been working on.
The American College of Physicians is the largest specialty organization of doctors, and next to the AMA, the second largest overall organization. It has a commitment to education, advocacy, career fulfillment, but at the top of the list, quality patient care.
Given that background, what unique perspective does your organization bring to the COLA's board of directors?
Well, for us, the AMA, we're proud to say that we advocate for the interests of practicing physicians across all specialties, all geographies, all practice types, whether you're independent, employed, academic, government, or other practice modes, and all stages of a physician's career, from medical students, residents, young physicians to senior physicians. We advocate for all physicians and physicians in delivering evidence-based, high-quality care. So I think we like to say that we bring that perspective to the COLA board.
And the ACP, again, represents the primary care internists, and along with the AAFP, two of the major primary care provider organizations in America, and represents a large number of doctors who are interested in delivering the best type of medical care and interested certainly in enhancing their care through the appropriate use of laboratory services.
And the AAFP wants to always make sure that diagnostic accuracy, supporting the family physician is always a central piece of interpretation of lab results within the context of a patient's overall health.
As I mentioned before, your organizations are part of our member organizations. So through that collaborative governance model, how does that representation strengthen the ability to serve laboratories and other physicians?
I think that COLA's, which is the Commission on Laboratory Accreditation's collaborative governance model within the AAFP, strengthens its ability to serve laboratories and clinicians through direct physician oversight, improved educational programs, and a greater understanding of the needs of point-of-care settings. As of COLA's founding organizations, the AAFP helps ensure that the organization's accreditation standards are clinically relevant and serve the interests of the family physicians who rely on accurate lab results for patient care.
I think, just having physicians on the board is so important because we're the end users, beyond the people who are actually in laboratory medicine and pathologists, the people who are actually ordering the tests. So we're trying to make sure that what we're talking about here in COLA and the accreditation standards are clinically relevant, makes sense to the docs who are the frontline users, and it's patient focused. So at the end of the day, we're trying to look at patient safety and trying to treat patients correctly, and that's what accreditation is all about.
The collaborative model really incorporates a wide net of expertise from the largest organization to two of the major primary care organizations. We also have the ability to add on board selected members that can add on to our skills in pathology and other evolving areas as needed.
So that brings us to education. I know physicians have a lot of education they go through. Laboratory science professionals have a lot of education they have to go through. We know that COLA accredits all size laboratories from very small to very large laboratories. But what does that role of education do? How does it play in to improve outcomes for patients? And how do physicians and laboratory science professionals work together to improve outcomes for patients?
I think that education for both physicians and laboratory professionals is crucial for improving patient outcomes by enhancing collaboration, communication, and the accuracy of diagnosis and treatment. Through interprofessional education, these groups learn from and with each other, leading to a better understanding of each other's roles, which fosters a team-based approach that reduces errors, lowers costs, and improves overall patient care.
We've always been a proponent of education. We talk about how important it is that people are educated, and education matters, and so does accreditation. It shows that people get the right information at the right time to help them make the right decisions for their patients. And so therefore the physician education is really important, both the end users, of course, the laboratory professionals and the pathologists, but also the end users and our laboratory directors and our personnel and our staff to understand how to best order the right test, but also perform the right test. And at the end of the day, that leads to patient outcomes. Just like we talk about everything else, training matters, education matters, and accreditation in this case matters. I mean, one of the things that I was talking about with somebody just earlier today was, how during the pandemic, I've never talked to my laboratory professionals more than I have, during that time period. And suddenly really understanding how the nuances in laboratory science and our laboratory medicine makes a difference in what we do. And if anything, during that time period showed how important it was that we all be educated on how labs work and what they mean to our patients.
I'll also say while education is certainly of paramount importance, it also it's important to acknowledge the role of incentives that help physicians do the right thing to get the best outcomes from their care, and occasionally disincentives in the opposite direction. IT tools can be especially valuable in reinforcing our educational efforts.
So COLA is an accrediting organization. We have deemed status from CMS. How can organizations like COLA help bridge gaps between the laboratory and the broader healthcare system? How can we be more involved? How can we help ensure that patient care is optimized?
Well, within our own healthcare system, the accreditation process, I think COLA stands out among all of the agencies in terms of incorporating education and advice and counseling, as well as the accreditation process per se. And those are invaluable adjuncts to the survey visits.
That's true. When you get a good survey, it's not just about whether or not you've checked boxes, but to learn best practices from the other places that surveyors have been to and understand how you can be better and understand where the things that you do need to improve on. So I think that education is really important. I'd also say that COLA, as you were alluding to earlier about all the different organizations here, we bring our various perspectives here, and then we can learn from each other as to what makes a difference for each of our areas. We can connect, we can educate, we've already talked about, but we can also advocate too. And since you're talking about the broader healthcare system, you were saying earlier about incentives and disincentives, we can help advocate for things that make sense, laboratories that help to advocate for more effective or efficient care or better value for the things that we do, and not to use the wrong test up front, right? To use a correct test up front so that we can make the best use of our healthcare dollars. And that's so important right now, as we can see in the greater sphere outside of COLA.
I can tell you with every confidence that since I joined the COLA Board of Directors as a representative for the AAFP in 2022, I can definitely see that COLA helps in bridging the gap between laboratories and the broader healthcare system through its educational programs, its rigorous accreditation standards, and above all, a focus on improving quality across all phases of laboratory testing.
There's so many things going on just with AI. We know it's going to hit medicine in ways we can't even imagine right now. We know we have a workforce shortage. We're addressing that in different ways. In your own opinions, what trends or innovations do you believe will have the biggest impact on laboratory medicine in the next 5 to 10 years? And it's not necessarily positive impacts. What are some concerns that you have as well?
I'm going to start with the positive impacts first, because that's where I go. But I'd say in the next decade or so, I think lab medicine will become more personalized, just like the rest of medicine, actually more personalized, potentially automated or data-driven, integrated with our clinical care, and then reshaping the way that diagnostics would support physicians and our healthcare teams. Where you think about, just for example, in cancer or other parts where your genetic makeup or your molecular testing, what might make a difference of what treatment you might get. Certainly right now in cancer care, if you have the right markers, you're going to have a different type of chemotherapy than somebody else. So you can imagine where our healthcare becomes very individualized and very personalized, and that's really exciting.
Cancer care is a great example. Just from 10 years ago to today, the outcomes are incredibly dramatic and favorable to patients. And I expect nothing more than an exponential continuation of that trend as we get more medical knowledge about the molecular pathology.
I can't stop short, but talking about the biggest impacts that would include artificial intelligence, which will improve diagnostics, personalized treatments, and automate administrative tasks. and COLA has been at the forefront with Laboratory 2.0 playing a major role. And there are other major impacts that will include expansion of remote and digital care models driven by other things like telehealth and greater focus on personalized and preventable medicine through genomics and data analytics.
I think that, if, especially when you're talking about AI, there's so many parts that it can hit and it can affect, right? Just the very technical part of automating, our CBCs now versus in the old days where you had to count every single cell, right? So, I mean, think about what AI can do with its visual AI and being able to do many of the things that we are more manual about now. And what will that allow our pathologists and our laboratory professionals to do instead during that time, maybe treat more patients, or since we're talking about workforce issues, to allow us to handle more patients, but also on the other end of other parts of running a laboratory, how AI can help you do that as well. So there are a lot of positives. Of course, there's always a lot of concern as well when you bring in new technology and AI. And I think it's important that all organizations, but since we're talking about accreditation, start thinking about what constitute an ethical, transparent, effective way of using technology, and not let it, not let the tail wag the dog in that sense, and have things out there that really end up not being safe.
Important points for sure. I think while the long term looks very optimistic, the short term is a little bit more threatening in terms of reimbursement. That seems to be inadequate in so many areas, including laboratory medicine and primary care. I think that reimbursement pressure leads to consolidation in a way that's not often favorable to the doctor-patient relationship. We have to be wary that we fight against those trends.
And I also think made me think for some reason about also how there's a more trend of democratizing information, right? A lot of our patients are getting their information not from a professional, but off online somehow, or getting even lab tests that are done at a stand-up place and they're getting their results without any context of what that actually means. It's good at least if they call the doctor and say, "Oh my gosh, what does this mean?" But for some people who just act on what they don't really know, it's hard enough for us physicians to figure out sometimes what the lab means, and to expect a layperson to understand the nuances is something we're going to have to talk about.
Couldn't agree more.
And from a primary physician's stand of view, I think that there's going to be a lot of opportunities to not only use the AI system to help reduce burnout amongst physicians, but physicians looking at other payment models, to work with their patients, spend more time with their patients, especially since patients are now receiving laboratory results before their primary care physicians.
I know a lot of people who go to Chat GPT with their laboratory results, and they may or may not follow up with their physicians. And with the reimbursement cuts you referred to, Dr. Eisenstadt, if legislation doesn't step in, laboratories are going to face pretty significant cuts in the coming January. So those are things we need to be very well aware of.
And you can't argue with the importance of a patient getting the most information about their health and their health care, but they shouldn't be relying just on the internet or chat GPT. They need that primary care doctor or that specialist doctor to guide them, because there are so many different avenues that information can come from. Some legitimate, some not.
Can imagine just sticking in a lab value and say, what does this mean? What do I do? And you don't know if the person has diabetes, you don't know what else they have. You just have this one lab value that somebody has plugged into ChatGPT and says, what does this mean?
Well, in the whole watching the trends of laboratory values,
Right.
One value within the normal range doesn't mean anything. If you watch it and it's increasing over time and it looks like the trajectory is for it to be out of range,
Right.
you need a physician overseeing that to kind of get involved and get there and take care of the patient before chronic disease sets in.
Yeah, it's like one note of a song. You need the rest of the words to know what the song is. And Dr. Kentavivi, you mentioned interdisciplinary education, which is so important. And a lot of programs are encouraging that and putting that as a part of their accreditation, to have that interdisciplinary knowledge for their students. So with that, I would love to hear your perspective from your organizations. How do y'all view that connection between the physicians and laboratory science professionals?
I think that physicians deeply value the work of laboratory professionals because accurate and reliable test results are critical for diagnosis, treatment, and patient outcomes. The partnership is essential as laboratory professionals provide the objective data and interpretations physicians need to make informed decisions and ensure high quality, cost-effective care.
I would agree with that. I think, as I sort of alluded to earlier, especially during the pandemic when it really just came to the forefront. I mean, when things are working well, you usually take those things for granted, which, the labs come out and we assume that there's good accuracy, we assume good quality coming from our labs. But during the pandemic, really put that front and center where every day we were learning a little bit something new. Is this PCR? Is it where we're doing antigen testing? What does that mean? Does this person really have COVID or not? Do we need to isolate them? And you really see that connection between a laboratory work and the laboratory results to what we're actually doing on the floor or what we're actually doing from a policy and advocacy standpoint in public health. And so we deeply value that, but I think especially in the more recent years where we really truly understood how much it makes a difference to have good quality labs and giving us the results that we need.
I think laboratory professionals may not fully appreciate how much they are appreciated by practicing doctors. That's a function of their success in providing this information to us for so long now. That information is always reliable and accurate and meaningful, and we need to do more to express our appreciation for their success in those areas.
We talk about laboratory, and a lot of people who've been in laboratory for years think of laboratories in the basement, pathologists sitting just glued to the microscopes. We've seen TV shows like Quincy, remember Quincy, where he would go down and look at gram stains. I remember that was the first time I saw a gram stain on the screen. And then all of these really wild shows came out where one person would run every piece of equipment and go out and get evidence and
Right.
come back. And that is so far from the truth. But Dr. Eisenstadt, you hit on such a good point that so many laboratorians are feeling underappreciated. They're feeling undervalued. The more equipment we get that's automated, the less they feel people understand their importance. I appreciate you saying that. So Dr. Jeffers and Dr. Kintabibi, what message would you like to share with the laboratory science professionals who are listening? And they may not truly realize how deeply the physician community values their work.
I will continue to say that, the partnership with laboratory scientists and professionals continues to be essential. I think that laboratory professionals provide the objective data and interpretations that we need as physicians, and all the informed decisions and high quality and cost-effective care that we provide to our patients is essential. And without laboratory professionals, I don't think that will happen.
First, I'm going to say that, all of us medical professionals shown on TV, or half of us are going, wait a second, where was I when that was happening? But it is true. First, I would just say thank you, thank you. I think a lot of times we don't take time to appreciate the people that we work with and recognize their subject matter expertise. I did allude to the pandemic, and I was CMO and leading the charge during the pandemic for 2 hospitals, but I was also for our specialty society. But even before that and after that, there's so many times now where we're talking to our laboratory professionals to understand what does this lab test mean for C. difficile and how does that affect our hospital-acquired infections? What's the best way to approach certain things and why can't we run this test on this person? Those things make a difference and really do shape not just that result and not just that one person, but also the policies that we create for the hospital, the policies and things that we advocate for the entire healthcare system. So I just want to say that it does make a difference. And it's our job to make sure that you do feel valued. And if we are not doing that, then we should do more of that. And also part of that is educating other people who are not involved in it to understand the role that laboratory professionals play in the healthcare system and patient safety and patient outcomes.
Laboratory data is so crucial in screening healthy populations to find problems that we can act on earlier to help them live longer and more happy, safe lives. And it's also of incredible value in identifying and determining the cause of problems that patients come to us with. It just works so seamlessly and so flawlessly for the most part that we take it for granted. And as practicing doctors, we need to be more aware of that and not just react when we're contacted because it's a financial problem with the test that we ordered or it's some clinical algorithm that we haven't followed. There's so much more to the laboratory professionals that goes beyond that I think we haven't acknowledged enough as practicing doctors.
COLA is collaborating pretty closely with ASCP, American Society of Clinical Pathologists, and they have a program called Leading Laboratories. We are working with them through our Workforce Action Alliance to have a national program for all laboratories by all accrediting organizations to really promote the great job laboratories are doing. So I encourage everyone who's listening to go to the ASCP website and look into this. We'll be having more information on it. I think we are even planning a podcast in the future so we can promote it even more. But we need to make sure the public is aware of the great work laboratorians do. And even though they're behind the scenes, they are so important in diagnostics of patients and finding what's going on before they get into these chronic illnesses. I do want to mention again the workforce shortage. We have the Workforce Action Alliance, where we work with many other national laboratory organizations. Some of the things we do are reaching out to middle school students, reaching out to high school students. By reaching out, I mean that we're going into the classrooms and they're donning lab coats and gloves and they're doing simulated testing and they're understanding the importance of laboratory work. We are working with different levels within the educational process with high school science teachers, with high school counselors, with university counselors, with MLS programs and with DCLS programs. MLS is Medical Laboratory Science. DCLS is Doctorate of Clinical Laboratory Science. For years, laboratorians wanted a way to promote up and stay within the laboratory industry. Well, about 20 years ago, the DCLS, Doctorate in Clinical Laboratory Science, was developed. And these people who go through that degree and earn the doctorate level add so much to assist the pathologists, not taking jobs away from pathologists. They're not there to read slides. Their background has to be that of an MLS, and they can help with operations. They can help with interpreting information. They can help coordinating care with other healthcare givers. So we need to keep in mind that there are ladders, career ladders within the laboratory industry. We don't want to lose people from our industry to go on and be a medical doctor if they have that desire to stay in laboratory medicine. So I encourage people to look at DCLS.
Nancy, when you mentioned Quincy, I thought of all the shows that highlight things. And just like you said, Dr. Jeffers, like you're like, wait, where was I at that point? I thought about The Pit. Love that show. And I remember after one part, a lot of people who work in transfusion medicine mentioning, wait a minute, but what it opens is the conversation, the conversation between different parts of healthcare. And at the end of the day, whether it was on that show and in real life, it is the patient. And us working together is so important. And as a laboratorian, it is good to hear from our physicians, the appreciation, because we don't always see what's on the other side. We don't always get to see that patient and all those dynamics that go on with other people in the healthcare team. So I think that is absolutely amazing to have platforms like this, to have this conversation. And to echo what Nancy was saying about our Workforce Action Alliance, as much as we want people coming in the field, we want them to stay in the field if this is what is for them. So that comes with the retention and understanding that we should all be appreciated as we do work for the patient to make sure we are having the best outcomes. So I think this has been a really good discussion. And I appreciate my co-host, Nancy, being on with me. And I would like to give my extreme appreciation to our board of directors and our members for joining us. Any closing statements before we conclude this episode?
Just say that we're in the worst job market in 15 years for people who are looking for employment. What better time to think of a career in laboratory medicine?
We love COLA, and COLA's education-based approach helps labs improve quality beyond simply meeting regulatory requirements.
Well, thank you for having us. And AMA is proud to be part of COLA. And we do, as I said earlier, believe in the education piece, the advocacy piece, and making sure that there's good quality standards for our patients.
From COLA's perspective, we dearly appreciate the AMA, ACP, and AAFP for being part of our board, and for each organization who appoints 3 members. That gives us 9. They then elect 3 more, as Dr. Eisenstadt was saying earlier, to have a board of directors of 12 physicians with varying perspectives on the importance of laboratory just makes COLA better every year. We take the advice from the board, we listen to how laboratory is used, and we instill their thoughts into our criteria. So Danny, as always, you did an amazing job. You pour your heart and soul into these podcasts and everything at COLA, and you are greatly appreciated.
Thank
For
you.
sure.
Thank you very much.
Thank you.
Be a part of the soundtrack of healthcare. Join us at COLA's Laboratory Enrichment Forum, taking place in Music City, Nashville, Tennessee, May 6th to the 8th of 2026. Visit cola.org for further information. Till next time, stay compliant, stay curious, and keep talking lab to me.